Miss L.R. Bagenstein. I'm Dr. Chen. Welcome to I'm a Planet in You Oral Surgery. Today we're here to talk about your implant. So the first thing we're going to go over is your medical status. It's basically to determine if you're a good candidate for implants and if this treatment's going to work for you. So do you have any, diseases or pathologies or any prescriptions that you're on? Well, that's a no. That's good. I mean, do you smoke? No? A bit. Diabetes? Nothing? Okay, that's great, because that means that the implant treatment might be right for you. So next thing we're going to talk about is the anatomy, and what I have here is my good friend. I call him John. So the only anatomy that we really need to discuss is that you have an incisive fossa, a canine fossa, the incisive foramen, and the infraorbital foramen. These are all very important since your implant's going to be in the anterior of your mouth. So after looking at your CT scans, we determined that you have healthy bone and you don't need to have any type of extra procedure. Go you! So thanks to our friendly neighborhood radiology department, it also looks like you have no pathology. Healthy as a horse! Alright, so now we're looking at how long this is going to take for you to heal. It's about 4 to 6 months depending on the patient and the osseointegration of the implant into your bone. And then there's about a 6 to 8 week healing process for tissue once we've placed the implant in. So that shouldn't be too bad. So we're looking like about 7, 8 months. We look like a good healer though, so we'll say 7. So how's your pain tolerance? That's the next thing we're going to talk about. Good? Alright, normally we like to manage pain with ibuprofen, and it looks like you could handle that. So we're going to monitor your healing, your pain, bleeding, swelling. If it's a little bit stronger, I can always prescribe you something a little bit better. Other than that, since you have no predisposing conditions, we have no antibiotics necessary for you. Alright, the final thing we're going to talk about is the possible complications. The first ones are called my bad complications, and hopefully we're not going to have any of those because I'm phenomenal at this. That's if we have wrong angulation of the implant or there's improper implant location. The second type of complications is called the what God gave you, or the anatomy complications. That's just dependent on where your nerve is. Sometimes there's bleeding in the area, that arteries around that. There can be cortical plate perforations. Or devitalization of adjacent teeth, so that's on endodontic pathosis. We also have post-op complications, and those can be infections, excessive bleeding. It can be a flat breakdown, but that's less than about 5% of patients. So infection, what we're really looking at is something rare called perioimplantitis. These ones I'm going to call on you complications. It's the failure of osseointegration or individual risk factors such as smoking, drug use, diseases, hygiene. So you got to promise me you're not going to use any drugs. Yeah? Okay. So really those are the major complications we can have. There can also be, possible jaw fracture, but like I said, I'm very good at this, so you won't have any problems with it. Alright, so finally now we're just going to do informed consent. Since it's all legal jargon, I'm just going to read it for you. All dental procedures may involve risks or unsuccessful results and complications, and no guarantees are made regarding any result or cure. You as a patient have the right to be informed of any such risks and potential consequences of not performing treatment, the nature of the procedure, expected benefits, and availability for alternative methods of treatment. You have the right to consent or refuse any proposed procedure at any time prior to its performance. Furthermore, if you have any changes in your health status or changes in your medicine, you will inform your dental provider. If you're taking bisphosphonates, which you are not, you may be at risk for osteonecrosis, which is basically bone death, and certain dental treatments may increase that risk. Do you understand? Oh, I'm glad you understand. Well, now that you're all good, we can start the procedures, and if you don't feel like staying here, you can always go to USC for your implant therapy.